Hello, I'm Evelyn from the Canadian Centre for Economic Analysis, and in this video, I'll be walking you through how to use our municipal COVID-19 databases, an example of which you can see up here on my screen. So before we get started, a little bit about us. The Canadian Centre for Economic Analysis, or CANCEA for short, is a data analytics group and a boutique consultancy firm that specializes in socio-economic analysis. Through our work over the last 15 years, we've developed extensive expertise in the fields of regional growth, demographic, economics, of course, and healthcare. Given the current economic crisis caused by the COVID-19 pandemic, we've decided to share our expertise with municipalities across the country as you plan for the reopening of your economies. So since Canada's in the midst of a once-in-a-generation crisis, we've decided to provide these data sets free of charge to each municipality as our way of supporting the recovery effort. So what's included in the database? Well, first, it includes demographic and employment information for your municipality that's current as of early 2020. And that includes population characteristics, income and employment information, health risks and pre-existing health conditions, lifestyle factor risks for contracting a COVID-19 infection. Data sources for this include Statistics Canada CANCEA tables, census data, labor force survey data, and data from various public health agencies that we've assembled from past healthcare-related projects. What the database also includes is estimates for residents of each municipalities at risk of losing their employment due to the crisis. So these are estimates based on a moderate COVID-19 recovery scenario where there's a single wave of COVID, the economy opens in late June 2020, and smaller outbreaks continue throughout the year, which cause economic disruptions. Information about this scenario and how it compares to the scenarios published by the Bank of Canada and other institutions is available as an accompanying document. Thirdly, the database includes credit risk information, which is data on people, on households and businesses under financial stress before the crisis and who are at risk of insolvency during the crisis. This uses data from the Office of the Superintendent of Bankruptcy Canada. Finally, before we get started, I just wanted to tell you about the LinkedIn users group. So you can see it right here, the Canadian Municipal Risk Analysis Users Group on LinkedIn. You can search for it, or if you just click here, it will take you directly to the page to request access, or right here as well. So we'll just take a look, make sure that you work for a municipality, and we will let you in. So that's the right place to ask any questions, to give us feedback, make any comments on the contents of this database. We also post all the accompanying information and reference documents there. It's a private forum where staff from municipalities that have downloaded our databases can share their questions with us and their ideas on how to use the database with one another. We also regularly post information about the updates and address common questions, so please do join the group. All right, so first, the Contents tab. This is basically a directory of the entire database. You can see basically what's included in each tab here and the link. You have a disclaimer here that basically outlines the terms and conditions for use of this database. In just a few words, the license agreement is very similar to the Statistics Canada user agreement. So if you've used StatsCan data, you kind of know what's included there. But if you want to see the full license, it is included as a tab here, and you can read it. Go back to the Contents tab. Down here, we have a directory of every single table and figure included in the dataset for easy access. So you could just kind of look for topics and then click on the table you would like to see, and it'll take you right there. All right, so I'll just walk through all the tabs and then we'll do a little bit more of a detailed walkthrough. So this overview tab here is basically, the goal is to give you an overview of everything that's included in the data set in an easy to read format that you can easily just print off, share. There's some explanations here and links to the more detailed data source. At the top of every tab that you have tables or figures, we give you a geography filter. So if you're a local municipality, we'll give you your local municipal information and some comparator regions. If you're an upper tier municipality, then you'll have all the lower tier municipalities and some comparator regions as well. Next, we have dashboards. So this is a way for you to interact with the data and visualize it and kind of get a feel for the shape of it. So in this one, for example, we've allowed you to compare two regions to one another. So you can filter the data by industry and look to see how that changes the figures. We'll go into that later. But they're organized by topic. So here, for example, we have things related to industry, then you have social services and health. These tabs in purple or blue are more detailed tables. So this first one here is basically just a check. It's for your own benefit. Basically, the goal is that you look at the population numbers and the employment and you make sure that it is actually accurate. We've made 3,500 of these, so on the off chance that we've sent you the wrong database, this is just a quick and easy way for you to check that you're looking at the right numbers. Next, we have the economic table. So same thing with the tables, they're all sorted by theme. All of them have a little directory here at the top and a geography filter. You can see what's included, and these tables also include explanations. And then finally here, we have the raw data. So this is basically useful for your municipal analysts. If you want to create your own pivot tables, analyze the data in your own way, you can directly pull the raw data from here, arranged by theme. The reason why it's in a bunch of different tabs is that Excel has a limit of 1 million rows. And we know that because we've broken Excel a few times making these. So this is our kind of creative workaround to give you access to all the data possible without breaking the whole system. All right, so we'll start at the overview tab. I'll give you an idea of what the tables look like. So here we have, for example, the risk of exposure to COVID-19 infection. So here you have it by age. There's 3 levels of risk: low, moderate, and high. Here we've included moderate and high, and then the percentage of the population that represents. Below we have a little explanation as to why this is an interesting table and what it could be used for. And then if you want to see the source with more detailed data and explanations of what these risk factors actually are, you just click here. And it'll take you right to the explanation and to the summary table. All right, back to the overview. We also provide a table of population health characteristics, so the number of health conditions that people have by age, and then percentage of each age group. Once again, explanations, metrics, why, and a link to the source. We also provide some data on mental health conditions and the prevalence in your community. So we have it by age, by type of mental health, and you have the percentage of the population as well. So we have current, which is in the somebody who's had an episode in the last 12 months, and former, which is they've had an episode in their lifetime, but not in the last 12 months. We have risk of job loss here. So this is by age, number of residents whose job is at risk due to the crisis, percentage of pre-pandemic jobs, and we give job loss, like I said, mid-year and at year end. This is broken down by part-time and full-time. And then finally, by income. So it's by income quintile, which basically means the first income quintile is the 20% of the population with the lowest income, and the 5th quintile is the 20% of the population at the upper end of the income distribution. So you can take a look at all the different tables. Basically, they represent tables that we thought might be interesting to municipalities. Like I said, you can print them off. It's kind of a quick and easy way to see what is included here. We've also included, for example, ability to work remotely, by place of work, as well as residences at risk of job loss by occupation. And then here you have industry level risks. So COVID risk by industry, which is kind of interesting if you want to know which industries are most and least vulnerable to outbreaks from your employees, from their employees, for example. You have essential employees and employees in essential industries that can work remotely here as a percentage of the total. and top employing industries in your area, and then the percentage of jobs at risk. And if you ever want to go back to the top, you just have to click this little back button. It'll take you right to the top. All right, so next I will show you how to use these dashboards. So the first dashboard is industry. So you select the region you want to see data for. So let's take, for example, Toronto, and say you want to compare it with Ontario. So you can see the numbers are different, the scales are different. So this shows you residents whose jobs are at risk, mid-year and end of year, and part and full-time. If you just want to look at certain occupation types, so for example, we know that people in sales and service occupations might be more at risk of job loss, and you have sales and service occupations across every industry, or across most at least. So you can select that, and then you'll see just people in sales and services occupation whose jobs are at risk due to the crisis by industry, by part and full-time. So if you ever want to reset these filters, all you have to do is press this little button with the red X, and then everything will be reselected. Also, if you wanted to select multiples, the trick there is to press Control as you click multiple options. So let's say we want to see management occupations and occupations in education and law and business. Those three. You just press Control while you click those, and then you'll see those three. And then we can just reset it right here. Down below, we have a different filter. So here you can actually filter these next set of figures by industry, and those are NAICS industries. So we can take a look at the risk of COVID-19 infection exposure. For example, maybe we want to look at public administration, see high risk, moderate risk, and low risk. You see how that changes if we click accommodation and food services. You see a lot more of that blue high risk. We also can see the breakdown of essential and non-essential workers. You can see that for accommodation food services, the vast majority of workers are non-essential, and it's broken down by occupation. Their ability to work remotely is shown here. So here you can see that most cannot work remotely in the food and accommodation sector. And once again, we're comparing regions here. And at the bottom, we see the residents who are at risk of losing their job during the crisis, broken down by mid-year, end of year, full and part-time. And you see the percentages as well. All right, so we'll just reset those filters and move to the next one. So here is the social service dashboard. So here what it shows you is basically residents with employment at risk. And it's broken down by all jobs, full-time employment, part-time employment here, and then here it's mid-year jobs at risk, and here is year-end jobs at risk. You can once again select your preferred region. Let's look at Ontario. And what this lets you see is the socio-economic characteristics of people whose jobs are at risk. So say we just want to look at renters. How many people who are renters have jobs at risk? Full-time, part-time, number, percentage. We can further filter it down. Say we just want to look at female renters. We do that. Okay, say we just want to look at females, but renters and owners, you remove that filter here. Further filters include mental health conditions. So if we want to look at anyone who's had a former mental health condition, or yes, a former mental health condition, we'll do that. And then you can clear the filter, and you can even filter by number of chronic conditions. So remember, if we want to select multiple, say we want to say 1 to 3, we'll click Control while we select 1. No, that's not working. There we go. 1, 2, and 3. So that'll show you females who have 1 to 3 chronic health conditions whose jobs are at risk. Just reset the filters there. Next, we have the health dashboard. So this basically shows the prevalence of different health conditions and COVID-19 exposure risk. So here are lifestyle risk types. This filter affects these two figures, so in this blue box, basically. So risk factors include building type, which I'll explain later, but basically a high-risk building is an apartment building where there's shared spaces. Another high-risk factor is having children in the household or commuting by transit. So basically you select whichever risk factor you want to filter for, and you'll see people who have that risk factor, and then the percentage of the population by age, by COVID risk exposure. So you can select multiple filters. Of course, the more you select, the smaller the population, because we're filtering down, because all of these filters apply simultaneously. And if you want to reset, as always, you just press the little X. So here we can filter it by health condition. So once again, same as above, the risk of exposure to COVID-19 infection. Here we have respiratory risk factors, since COVID-19 does affect the respiratory system. We just separated those out for you. So if you want to look at the population that has COPD and is a current smoker, you can see it skews significantly older, and they're all mostly at low risk of COVID, except in the lower end of the high age group. You can always reset it here. And down below here, we have other health risk factors. So for example, presence of active cancer, dementia, diabetes, heart disease, blood pressure. This is just the prevalence in the population divided by female, male, age, and then you see the percentage of the population with those risk factors on the right. For example, if we just want to see the population with no risk factors, you would click no for all of them here. Sometimes it takes a little second for it to load, but just be patient. There we go. So we can see this is all the population that has none of these risk factors, and then it's the percentage of the population that has none of those risk factors. And then you also have mental health history filters. So I can always reset. Just make sure, always be aware of which filters are on, so that you know you're looking at the right data. All right, so the tables. As I mentioned, this one's more of just a check for your own benefit. Next is the economics table. So here's the list of all the tables included in the tab. Here we have the risk exposure, and we have the explanation of what it is to have high or moderate or low exposure risk to a COVID-19 infection. Kind of talks about our methodology and all the different risk factors individually, which I'll get to later. Here we have the risk exposure by industry, by occupation and industry, so you can use these drop-down menus to filter it as well when they're available. Down here, it's kind of the employment baseline. So pre-crisis, how many people were employed in essential industries and non-essential, and could work remotely or not work remotely by industry. And work remotely, in order to be considered able to work remotely, at least 50% of the work can be performed at home. As you scroll down, you can take a look at the other tables. This, for example, is occupations by essential, non-essential, and ability to work remotely. And then you just have the breakdown of occupations and industries, the big matrix there. And this is all baseline information, pre-crisis. Now you have industries by age. And now we have risk of job loss, mid-year, end of year, full and part-time by industry. So as you can see, it's just, we've just provided a bunch of different breakdowns for you to make it easy, but you're also able to go right into the raw data and create your own breakdowns if none of these are what exactly you're looking for. Down here we have place of work. So for example, no fixed workplace before the crisis, or they always went into work the same place or worked at home, worked outside of home by occupation. And if you ever want to go back to the top or the directory, you just press that button. Next, we have the credit risk tables. You can filter it. This is only available for upper tier municipalities, so regions and Ontario, due to the nature of the data that we're using. All the definitions are here. So this first table is people. So the definition of household financial stress, so this is people in households that are in financial stress, and it's defined based on the percentage of income that a household spends on housing. So moderate financial distress is when a household is spending 30 to 50% of income on housing, and extreme financial distress is spending over 50% of income on housing. And you can see it by household structure. This is financial distress prior to the crisis and percentage of the population. This is the population who is in financial distress prior to the crisis and their jobs are at risk. And this is the insolvency risk for 2020. And the definition for household insolvency is found here, or the way we calculate it, rather. So you have the same information, but for households, so these are household counts. And then you have it broken down by owners with a mortgage, by renter households. And down here we have businesses under financial stress. So this is broken down by industry. These are business counts. This is financial distress prior to the crisis and insolvency risk by size of business, percentage of all businesses. And these are based on historical insolvency data from the Office of the Superintendent of Bankruptcy Canada. All right, so next we have the risk exposure tables. So here you can filter these by region again. Let's look at Peel to switch things up, and by sex. So these are the factors for risk exposure to a COVID-19 infection. So we've considered 6 factors in our overall calculation of risk, which are the following. So first, it's if you have to use public transit to get to work, that puts you into contact with more people, therefore that's an elevated risk factor. Second is occupational risk. What's occupational risk? Let's click on it. So occupational risk takes into account the essential or non-essential nature of the work and the occupation. So there's 3 occupational risk factors within this category. So that's contact with others. So does your job require you to be in contact with others to be able to perform your job? Physical proximity is the degree to which you're required to perform tasks in close proximity to other workers. And exposure to disease and infection, that's the extent to which the job requires the disease to be exposed to hazardous conditions. And where the methodology comes from is outlined here. Live in a higher risk building, that's an apartment building. Have children at home. Children can be a vector of disease. If they go to school, they have different interaction patterns, so it's an elevated risk. And finally, higher social interaction outside work. So the definition here is people who live in a single person household and are between the ages of 20 and 50. They're considered to be at higher risk because they are likely to have more frequent social interactions outside of work. And this contact with people from multiple households can be considered a risk factor for COVID-19. So you have tables relating to all these different these COVID risk factors. So commuting, public transit, industry and occupational risk, ability to work remotely, et cetera, higher risk dwelling, children in the household, social interactions. You can always go back to the top and filter it. We're just looking at females. We can look at all, we can look at males. And the next tab is health information, public health. So you can, of course, once again, filter it by region. Here is just an overview of the population with any chronic health conditions by health conditions. So COPD, diabetes, asthma, heart disease, arthritis, cancer, dementia, substance use, et cetera, et cetera. Definitions for commonly asked questions are usually found below the tables. Here are the age profile of diseases. You can use these filters here to see the prevalence, the combined prevalence of multiple risk factors. So click all if you don't want it filtered, and click, select one if you just want to see people with not high blood pressure, for example, and no arthritis or arthritis. Basically select whichever filters work for you. These are a bit less easy to use than those buttons, but you can see which filters are selected here by age, by degree of COVID risk exposure. Here we have mental health by COVID risk exposure and by age. You can select, once again, which mental health status you would like. So you can see prevalence. So remember that every filter you select, all of them will be applied at once. So if you select yes to mood disorders and yes to substance use disorder, you're only going to see the population who has a mood disorder and a substance use disorder. We have here comorbidities. Comorbidities is the presence of one or more health conditions occurring simultaneously in the same person and crossed by other health conditions and by mental health. And down here you have another table that lets you filter by all risk factors and all health risk factors. And the last tab with tables is social service factors. I'll go back to the top here. So here you can see the population with any current mental health condition by COVID risk exposure, low, medium, and high, by age, with former mental health condition, with chronic diseases, and by COVID risk exposure, COVID risk exposure by type of dwelling, all sorts of cuts. Full-time residents who are at risk of job loss by tenure, owners versus renters by age, and by COVID risk exposure. This is all the tables we could think of that would be interesting to municipalities here. So lots of different cuts, and you can go back to the top. All right, the last thing I'll show you is this figure in this tab here. So this is a visualization of the ability to work remotely and occupational COVID risk. You can see that there seems to be a little bit of a correlation. So higher ability to work remotely is closer to the 1, less ability is closer to 0. Not all the dots are labeled because that would get quite busy. We've also included information about median wages, and that's the color of the dots. So you can see that dots are quite a bit darker in this area here, which are jobs with a high ability to work remotely and low COVID risk. You can also see how many people work in each of these occupations by the size of the dot. So just an interesting visualization of occupational risk there. All right, so that's it for now. Thank you so much for taking the time to watch this little walkthrough. Please do join the users group and ask us any questions you have there. We welcome your feedback and we look forward to your comments.